we'll go on to the first presenter, and yeah, we have 3 in this session. So, Rashmi, please go ahead.
Thank you. So at the outset, I'd like to thank AIOS for the opportunity to present our work. So we all know that keratoconus is a bilateral and often asymmetric corneal ictatic disorder, but often we see that some patients remain stable while others progress, and even in the same individual, sometimes one eye remains stable while the other eye keeps progressing. So we asked the question as to why do some eyes progress while others remain stable, and the purpose of this study was to analyze the biomicroscopic changes in progressive keratoconus and correlate it with the biomarker changes to understand pathophysiology of progressive disease. So we included patients who were more than 18 years of age with bilateral keratoconus, but on follow-ups had a unilateral progression only. And patients with previous ocular surgeries, patients with allergic conjunctivitis or VKC, patients on topical medications or contact lens users, and patients with hormonal disorders or any kind of hormonal replacement therapy were excluded from the study. The sample size was calculated and found to be 15 in each group, and both eyes of the same individual were used so that the risk factors were similar in the study. So we included 20 patients. That means there were 20 stable eyes and 20 progressive eyes. And in each visit, patients underwent slit lamp evaluation, corneal topography, confocal biomicroscopy, and tear sample collection at baseline and the follow-up visits. So the confocal microscopy image was analyzed using the automated CC-metric software, which annotates the image, and it looks at the nerve branches and the main nerve fibers, and it gives the calculated parameters as such. The tear samples were corrected using the Schirmer strip method, which was stored in Eppendorf tube at -80 until it was seen which eye was progressing and which eye was stable, following which the tears underwent BCA analysis and further ELISA testing to look at the biomarkers. So looking at the confocal results, at the baseline, there was a significant difference in the corneal nerve fiber density, nerve branch density, nerve fiber length, and the total branch density between the stable and the progressive eyes. These were the representative images where the nerve density differences were visualized. We also looked at the keratocyte density, but we did not find any significant difference between the stable and progressive eyes in the anterior stromal, mid-stromal, or posterior stromal keratocytes. On follow-up visits, we saw that the stable eyes, as compared to the baseline visit, was still not having a significant difference in the parameters of the on the confocal microscopy. But in progressive eyes, we saw that the corneal nerve fiber density, the nerve fiber length, and the total branch density continued to reduce, and this was statistically significant in our study. So we further went ahead and did a correlation analysis where we looked at all the biomarkers to see what was really causing this structural change that we were seeing. So we saw that there was a strong correlation between the subbasal nerve plexus features, and interleukin-2, 21, and CCL2 were the biomarkers which came out as significant. So to delve deeper, between the progressive and the stable eyes, the interleukin-2 and 21 did show statistically significant difference with corneal total branch density. There was a significant strong correlation, which was not seen with stable eyes. Similarly, in CCL2, it was significantly correlating with corneal nerve fiber density, total branch density, and the nerve fiber length, which was again not seen in the stable eyes. So we could conclude that there was a significant difference in the nerve parameters correlating with the tear cytokines in progressive eyes as compared to stable eyes of these individuals. So to discuss further, it was already known that there is a confocal microscopic change in the subbasal nerve plexus features, which is seen in keratoconic eyes as compared to normal eyes. And we also know that there are specific inflammatory biomarkers which are increased in keratoconus as compared to patients who don't have keratoconus. In this particular study, we were able to combine the biomicroscopic changes on confocal and correlating them with the biomarker changes that we are seeing. And we could come up with specific biomarkers which are seen only in progressive eyes versus stable eyes. So to conclude, what we already know is that keratoconus is a bilateral and asymmetric disease, but not all the eyes progress at the same rate. And confocal microscopic changes in nerves as well as keratocytes are seen in keratoconus as compared to normal eyes. But what this study adds is that there's a significant difference is seen in the corneal nerve parameters in stable as compared to progressive eyes in keratoconus. We did not find any difference in the keratocyte density. And interleukin-2, 21, and CCL2 may have a role to play in these structural changes that we are seeing and could be targeted to arrest progression further. Thank you.
Rashmi, Nice presentation.
Thank
For the confocal microscopy, for the nerve density, you already have the CC-metrics software. But how
Yes.
did you check the keratocyte density? Did you do a manual calculation?
Cell counter on the confocal only.
You-
So we
no,
use an
did you do a-
HRT.
Okay.
So we sat and
You,
checked the
you did it manually?
Yes.
And was it the same person, observer, for all the scans for all the
It was the
patients?
same observer.
Same observer.
Yeah.
Yeah, we invite the next speaker. Thank